Hello, my name is Allie Schuster. I'm currently a grad student at Drexel University. This presentation will be an analysis of the research study titled Post-Operative Mortality, Miscare, and Nurse Staffing in 9 Countries, a Cross-Sectional Study by Ball et al. 2018. Introduction. The independent variables this study will be addressing include missed nursing care, nurse staffing, and nurse education, while the problem under investigation is patient mortality within 30 days of admission in surgical patients who underwent routine surgical interventions. Background and significance. Nurse staffing has continued to be an issue, especially during the COVID-19 pandemic. Changes in nurse metrics can have a large influence on patient outcomes. Mortality rates have been used as indicators of effective healthcare in previous studies. These studies have shown that adequate nurse-based staffing is necessary to provide adequate care, with poor nurse staffing being associated with high mortality rates. This relationship has been researched across the world. Researchers have examined the relationship between missed care, also referred to as incomplete care or nursing care left undone, and nurse staffing. And when there's low nurse staffing, more missed care occurs due to lack of adequate time to complete these tasks. Missed care has been associated with poor patient outcome. Thus, missed patient care is both an outcome of poor nurse staffing as well as a potential predictor of poor patient outcomes. Examining these variables are very important for both nurses and patients to ensure safe and quality healthcare. Problem statement and purpose. The problem laid out in the study is that the current literature lacks sufficient data pertaining to mortality rates and variation in post-surgical care, and the role of poor nurse staffing in missed patient care plays in this population. The study does not provide a specific hypothesis, but does include a purpose, and the purpose of this study will be to try to understand the relationship between missed nursing care, nurse staffing, nurse education with patient mortality, and examine if missed patient care is a mediator between nurse staffing and patient mortality in post-surgical patients. Research design. This is an observational study to examine relationships between variables without a specific intervention. This study is a secondary analysis because researchers of this current study used previously collected data referred to as the RN forecast study data, which was collected from 2009 to 2011, as referenced in Sermius et al. 2011. This study combined data from 422,732 surgical patients with survey data from 26,516 nurses about staffing and missed care in 300 hospitals across 9 countries, which are listed on this slide, with the goal of examining the relationship between nurse staffing, missed care, and 30-day inpatient mortality. Sampling method. This research study utilized already collected data. Again, the sampling method is outlined in Sermius et al. 2011. The sampling method outlined utilizing a non-probability sampling method because participants were non-randomly recruited to participate in this study. This type of sampling was purposeful because a specific group, nurses, were asked to participate and partake in different surveys about working conditions. Specific parts of the survey are used in this current research analysis. Data collection and surveys were performed at hospitals with at least 100 beds that treated at least some adult patients. Nurses were excluded from partaking in the survey if they were on maternity leave, on vacation, or on sick leave. Response rates were around 62%. Research instruments. Sermius et al. 2011 outlined the survey techniques that were utilized to collect the RN4CAST data. This study collected data for mortality measures, nurse staffing, and missed care, as well as nursing education. Data was collected by trained professionals. First, the 30-day mortality variable was calculated using length of stay and mortality status. The nurse staffing variable was measured through the nurse survey by asking nurses to report the number of staff providing direct patient care and the number of patients on the unit during their last shift. Mean patients per RN was calculated for each hospital. This way of measuring nurse staffing was validated by the University of Pennsylvania to be an appropriate measure of nurse workload. The variable of missed care was measured using the question, on your most recent shift, which of the following activities were necessary but left undone because you lacked time to complete them, for 13 specific nursing activities. And this type of survey has been utilized and validated by previous research studies to adequately represent missed care. Percentages were calculated and averaged for each hospital for missed patient care. And the nurse education variable was represented using a percentage of nurses who had a bachelor's degree. Statistical analysis and symbols. So using the Barron and Kenny method, a mediator testing was to be performed, and this used simple logistic regression and multinomial logistic regression. Simple logistic regressions, this type of analysis predicts relationships between one independent and one dependent variable. Can make predictions about, this type of analysis is inferential because it makes predictions about populations using the results of the study, and the dependent variable in this type of analysis is categorical. Multinomial logistic regressions were utilized, and this type of analysis predicts relationships between multiple independent variables with one dependent variable. Again, this is inferential, and the dependent variable is categorical. Statistical findings. All logistic regression models were adjusted for specific hospital characteristics. In Model 1, it shows that nurse staffing and nurse education were significantly associated with 30-day mortality, as seen with the significant p-values of 0.0002 for nurse staffing and 0.0019 for nurse education. Each addition of a patient per nurse was associated with a 7% increase in odds of patients dying within 30 days. And a 10% increase in bachelor's educated nurses was associated with a decreased mortality risk by 7%. Model 2 shows a significant association with missed care, as seen with the p-value of 0.0084. With each 10% increase in missed care, each 10% increase in missed care is associated with a 16% increased risk in patient 30-day mortality. Additionally, Model 3 integrates missed care with nurse staffing and education as covariates with 30-day mortality. The relationship between missed care and mortality is decreased, as seen with the odds ratio of 1.056 and a p-value of 0.0392, while nurse staffing and education remain significant, indicating a potential mediating effect. Model 4. Model 4 was estimating the mediation effect, and this type of analysis was calculated using Bayesian methods, and this model builds upon the relationship that miscare mediates the relationship between nurse staffing and mortality. The indirect effect was significant in the model, while the direct effect was not significant anymore in the model, indicating a mediation effect. Results. This study showed that missed nursing care due to time restraints, nurse staffing, and nurse education were all separately associated with 30-day mortality of inpatient surgical patients. This study also showed that missed care acts as a mediator between nurse staffing and mortality in this population, which is a novel finding. This means that there may be more care missed when nurse staffing is poor, which can then in turn lead to increased risk of mortality in post-op patients. This finding also found that more bachelor's educated nurses was associated with lower post-surgical mortality rates, indicating the importance of nursing education. Threats to validity. Internal validity refers to how well a study was constructed and executed. Threats to internal validity must be considered when evaluating this study. The threats of instrumentation needs to be addressed. This refers to the effects that changes in the instrument or personnel administering the instrument can have on data collection. The survey data utilized in the study was administered by different individuals in different countries and translated into different languages. This could have caused slight changes throughout the different countries and the languages that could have an effect on the data being collected. And historical events occurring in this time also may have had an influence on the result. Different external events could be causing an increase in the census of patients in the hospital or the stress of the hospital, which could in turn cause nurses to rate their staffing or workload in a more extreme manner. Slide recommendations and clinical significance. Even though medical errors are the leading cause of death in hospitalized patients, it is important to consider how nurse staffing affects patient care because miscare was shown to be associated with mortality. Miscare could be partially avoided if there is adequate staffing in place. Unlike some other safety-critical jobs, nursing does not have policies or regulations to ensure safe staffing. Additionally, recommendations for further research includes examining which specific miscare items were associated with 30-day mortality to get a better understanding if one is more important to patient safety. Additionally, it may be important to examine the staffing of other healthcare professionals that have direct patient care that also may have a direct effect on patient outcomes or an effect on nursing outcomes. And here are the references that were utilized in this presentation. Thank you for listening.